It's no secret that the high cost of healthcare is a significant concern for most Americans. The United States spends around $4.3 trillion on healthcare, representing 18.3% of the gross domestic product. In 2022, overall prescription drug expenditures in the United States were less than 1 out of every $7 spent on healthcare. The reality is, hospitals are the single largest driver of healthcare costs, and approximately 75% of adults with medical debt owe that debt to hospitals. Despite catchy phrases that poll well and simple solutions by politicians promising to fix the problem, such as prescription drug advisory boards or PDABs, it is mindful to remember one thing: if it sounds too good to be true, then it probably isn't true. PDABs, in implementation, focus on reducing government and insurer prescription drug expenditures, not patient costs. The boards are government-sanctioned units comprised chiefly of providers, insurer or payers' representatives, government officials, drug manufacturers, and other medical providers. Few, if any, have patients themselves serving on them. This could lead to incentives for insurers and government programs to prioritize outdated medications over what patients need, or increase administrative barriers patients face in getting their medications. Patients want the medications prescribed by doctors, not more hoops or hurdles to jump through. PDABs are increasingly targeting life-saving medications, including those for rare diseases like cancer, HIV, and hepatitis C. While well-intended, the impacts of these actions threaten the patient-provider relationship and the funding safety net providers rely upon to provide timely, appropriate life-saving care. PDABs are basically price-control wolves dressed up in sheep's clothing. But patients and patient advocacy groups have caught on to this gimmick and are demanding answers. Collective knowledge is power. It is essential for patients and advocates to engage with PDABs, to give them a proper patient-centered consumer perspective to contrast with their industry-leading priorities.